This morning on the Hot Takes, we're talking all about PCOS, that's polycystic ovary syndrome. This whole month of September is PCOS Awareness Month, and we've got Dr. Sarah Krantz in studio. She is an OBGYN at Jacaranda Maternity. Good morning.
Good morning. Thanks for having me.
Thank you for coming.
Yes.
Thank you so much. And we've also got Aashka Doshi, who is a part of the Radio 44 team. Aashka, you know, when we were talking about PCOS, you've been telling us about your journey and everything. So thank you so much for coming on and actually speaking about it on a public platform.
Thank you for having me.
You're most welcome.
Well, let's just dig into it. Dr. Sarah, what exactly is PCOS? Because, it's a term that's been used, but not many people are aware of what PCOS stands for.
PCOS is a difficult condition to describe, and that's because it's not a disease that you can catch. It's not even a disease that we can do a genetic test for and say you have it. It's a name that we call a cluster of symptoms and findings in a woman, and it's basically a criteria that you meet and we say, oh yes, you're presenting as someone who has PCOS.
Right.
And so the basics of it is it's a condition of anovulation, which means someone who ovulates irregularly or not at all, and excess masculine hormones, basically. So when you have, it's called hyperandrogenism, which is where you have elevated testosterone or similar kind of male hormone floating in the system, which can cause signs and symptoms of what we call PCOS. So things like excess acne, excess body hair, we call that hirsutism, because it's hair that can happen on the face, neck, chest, and then the issues of irregular periods.
All right, thank you for that definition. I can understand it at least. I was a little bit scared I wouldn't catch on with the scientific terms, but thank you so much for simplifying it as well. Tell me, how common is PCOS, and is there any link to race and your chances of having PCOS?
So PCOS, depending on the criteria you use to make the diagnosis, can be anywhere between 5 and 10% of the reproductive age population, which is actually quite common if you think about it that way. As far as race, I think there's no definitive science on whether it's more in certain groups, but it's an area that's being actively researched and we just don't know enough yet.
All right. Aashka, moving on to you. How long have you had PCOS?
About 8 years now.
Wow. Okay, so you got diagnosed a little bit later than the average?
Yeah, I got diagnosed when I was 19 years old.
All right.
Usually they say that by 18 you know for sure that you do have. So I got diagnosed when I was 19.
Is that right to say? So was she on like the later side of it, or?
So interestingly, PCOS can actually appear even later than that, because sometimes for women it is tied to having excess body weight. And so sometimes that's a body that people grow into as they age. And so some people won't have irregular periods until they're into their 20s. And even it's a condition that can be reversible. And so you can, if we intervene and we do the certain recommendations, you can actually go back to having regular periods and not having the signs of PCOS.
Oh.
That's encouraging to hear that it's at least reversible. If you have any questions for either Aashka or Dr. Sarah Krantz, let us know. 0758 123 444. This is a topic that's very important to the Morning Fix.
Yes.
We love having these topics that are affecting our audience.
The different types of topics where not many people talk about it.
Yes.
But then we're trying to get you in that zone, think about this kind of things.
Totally correct. Get that conversation started right here on the Morning Fix.
What's the initial symptoms of PCOS? I know Aashka got it at the age of 19. We spoke about the age differences when you get it. But what are the initial symptoms of PCOS?
So the symptoms that will often lead women to come in for evaluation are irregular periods. That's the most common, because they may have gone either from having regular periods to having irregular or having no periods at all. So that's usually what prompts people to come to the doctor to say, hi, I need an evaluation. Another cluster of signs and symptoms that we fit into the diagnosis of PCOS would be excess body hair, like the sort of male pattern body hair that we talked about, whether that's face, chin, neck, chest, and this would be like the dark terminal hair, not just like a soft or light colored hair. And you can also have male pattern hair loss. So that can be like receding hairline, things that you'd typically associate with male pattern. And then also excess acne. So those are some of the things that we see when people come in. But almost always this is accompanied by irregular or absent periods.
And what about patterns in genetics? Does it mean if my mom has PCOS, I'll definitely get it, or is it more random?
So there is some relationship, but we have not, as far as I know, narrowed this down to any kind of genetic signal, something that we can test for. But we do know that there's some overlap with metabolic syndrome, which is where people can have insulin insensitivity, high blood pressure, high cholesterol, or high triglycerides in their blood. We know there's some overlap, and you do see that sometimes in families.
All right. And Aashka, what about you? So you got diagnosed at 19, and now, what are those treatments you've tried over the years? The ones that worked, the ones that didn't work?
So I've tried a lot of fad diets before I understood what my body really required to lose and fight my metabolism rate, because it's really slow. That's what I understand, that PCOS makes your metabolic rate very slow. So I tried a lot of fad diets until I realized that I need to eat even to lose weight. It's not like if I stop eating, I will drop my weight. Exercise was one thing on my to-do list, no matter what. I feel like it's like an exercise to get out of bed to do a physical activity. It's really tough, with your weight. So it was really hard, but a combination of medications and lifestyle changes, it's helped me to get where I am right now.
And what about you, Dr. Sarah Krantz? What do you recommend your patients? Or it obviously matters depending on the patient, but what are some of those treatments that have really helped the people you've seen?
Yeah, so interestingly with PCOS, about 80% of women diagnosed with PCOS will be overweight. But there is about 20% who are normal weight who can still suffer from the same condition. So the hallmark of treatment for PCOS is weight loss. And what we found is that if you can reduce your weight, even by a marginal amount, it doesn't have to be a goal like a certain kilo, but it's actually just a percent of your own body weight that you're starting with. Even as little as 5% loss can return you to normal ovulation or to irregular ovulation. So it's really quite tied to that. So that's actually the first recommendation, is lifestyle changes, usually through exercise and diet. I did look into if there's any kind of fad diet that's better than others, and the only thing that the research has shown is caloric deficit, just less calories, unfortunately.
So with PCOS, it's really funny because sometimes there's an information overload for patients, because you go online and you say, what should I do for PCOS? One site is telling you do keto, the other side is saying do a vegan diet, which is very opposite from each other. The other is saying, don't lose weight, just do this, do high intensity exercise, do only cardio. What do you say to these patients who have just too much going on, too much information overload?
Well, I would say, number one, I am not a weight loss expert, although a lot of weight loss experts are also not weight loss experts, as it turns out.
Mic drop.
But like I said, the research just shows caloric deficit, and so whatever works for your body, we're all built differently. And so for some people, they're going to show, I did keto and I did so well with it. Wonderful. Congratulations. It's not going to necessarily work for everyone else. So I think the biggest thing is let's all not shame each other on what we should be doing. You have to find what works for you. And so we know exercise works because you burn calories, and we know, unfortunately, taking in less calories works. And whichever style works for your lifestyle and that you can be consistent with, that's the best path for you.
I think, Aashka, that's what you had mentioned to me earlier as well. Just do what works for you.
Yeah, just take small steps. Take one step at a time. You will reach there.
Aashka, you mentioned you got diagnosed with PCOS at the age of 19. Can you just take us through the journey of dealing with PCOS, controlling it?
Yes. Well, there were a lot of ups and downs. It's like taking 2 steps forward and then 5 steps backward. You think you've reached, and then you've actually not. Like I said before, it's a combination of medication and lifestyle changes. For me, what worked was majorly my lifestyle change and dropping the weight. And with PCOS, when you go to the doctor and you're told, you may have high risks of having diabetes, or infertility and weight gain. They tell you so much. It's so much information, and it leads to depression as well. So it's a lot of mental work.
That too, when you're just a teen.
Yeah. So but I had very supportive family and friends that have brought me and always motivated me that whether you're fat or you're thin or you're overweight, underweight, with Hirsutism, without, you're fine. Just they were there for me, and I think you need people around you who motivate you like that.
What about the mental aspect of being so young and seeing those changes in your body? How did that affect you at that time?
You don't like looking at yourself in the mirror. You're seeing acne, you're seeing facial hair, going to remove the face. You don't want to take pictures, you don't feel like a teen, you want to go for parties, you want to wear your nice dresses, but you can't. Until you see changes in your life, you can't. And it's just a confidence breaker when you see yourself, It comes with self-blame, it comes with negative self-image of yourself. So yeah.
Gosh, Dr. Krantz, I'm sure you've seen these mental challenges in some of your patients. What are the symptoms you see, like depression, anxiety, and how can someone who's just got diagnosed just deal with that initial shock maybe?
There certainly is an element of depression or negative self-image, which is totally understandable when what you're seeing in the mirror doesn't match, what you feel like you should look like or how you should feel about yourself. I think the message is there are things that we can do about this. This is something that we understand enough about that there are steps you can take. And if you work diligently and you work hand in hand with your gynecologist, there's hope. And as you can see with Aashka, you can lead a very productive life and feel good about yourself and gain perspective on it. But she is absolutely right. Hearing that message as a teenager, very difficult. Very difficult.
I'd just like to add, you need to prioritize yourself. If it is exercise, you want to go for a spa, you want to go with your friends, just prioritize yourself.
Did you have a group of other girls who are facing?
You see, when I was diagnosed, not many people were okay to talk about it. But I do see now there are a lot of groups that are talking about these things openly. But no, because my mom battled with PCOS, I had a lot of support from her as well. And my family, like my dad, my brother, my husband, they were all very supportive. So if I had to talk, they were there for me. I'm thankful for that.
I love that message.
Yeah.
So prioritize yourself, and if you have someone who's going through this in your family, you might not realize how much of a big deal it is. So do make sure that you are there for them. Thank you so much for opening up about that, Aashka. Like, one of the things, even when we are finding guests,
it's not easy to find people who want to talk about it.
It's very personal. I don't blame them for not talking about it. But here we are. If you have any comments, I'm seeing just one WhatsApp right now that's saying, I can relate to exactly what Aashka is saying. So thank you so much again, Aashka.
There's one question generally that goes around, especially in the Indian culture. When someone says PCOS, you're like, oh, she's infertile. That's the first thing that goes around. So if a PCOS patient is looking to become a mother, how do they go about this?
So first of all, there's a spectrum of the disease, right? And so for some women, it's that they ovulate irregularly. And then for some women, it's that they do not ovulate at all. And so for someone who ovulates irregularly, you certainly can become pregnant. You just need to release an egg and have the right conditions occur, and you can become pregnant. And so that's how we have Aashka sitting here today, obviously, is someone had PCOS, so irregular release of an egg, but enough to become pregnant. And so it is not hopeless, and it's very individualized, okay? So for someone who doesn't ovulate at all, obviously that makes it a bit tricky, but there are medications that we can try that actually stimulate ovulation. And then there's also more advanced reproductive technology that's certainly an option, because from what we know, PCOS does not preclude carrying a pregnancy. It's just getting all the right circumstances to become pregnant and conceive.
The other side of the spectrum is sometimes when you're very young and you have PCOS, you don't really look into birth control because you think, I'm not going to get pregnant. I don't even get a period. What is the importance of young girls who have PCOS and the link with birth control?
I'm so glad you asked that, because I think this is my biggest message for women who struggle with PCOS, and that's if you're having irregular or no periods at all, it's very important that you come to the gynecologist. And that's because, number one, you could ovulate irregularly, and that could put you at risk for becoming pregnant when you do not intend to. But number two, actually not having a period for a long period of time can put you at increased risk for developing endometrial cancer. And I don't want to use the C word and scare everyone, because this is something that we can very easily protect against by taking birth control. And so if we give birth control and you regularly shed the lining of the uterus, it sort of mitigates that risk.
Right. Oh.
There you go.
I never knew that. I never even thought about
a lot of people with PCOS don't know that.
Don't know that. Exactly.
So thank you so much.
Yes, Aashka, any last words? What is the message you want to tell everyone out there?
A couple of things. Don't be shy. Please talk about it. Find a friend, find a doctor. Please be vocal about what is happening to you. We're all here. We can be with you. Call Radio 44, find my number. I'll talk to you. Another thing, celebrate yourself. Nobody knows what it takes to be you. So, yeah.
Wow.
That's really nice.
That is nice.
Oh, this is a very wholesome
Yeah.
interview. Thank you so much, Aashka. And thank you. Dr. Krantz. Do you have anything last words to add?
I just think everyone is an individual, and so it's really important that you walk this journey with your gynecologist, with your friends and family, and there is support out there for you. So come in and please ask for help.
Awesome messages there. It's been a very educative session for Bhargav and I.
Yes.
As
very much
usual.
so. Yeah, always.
We're learning a lot.
We do.
And we're learning with you. So that's been our PCOS awareness interview. Thank you so much for coming out and talking about this. You can find Dr. Sarah Krantz at Jacaranda Maternity. If you wanted to check her out, she's given us so much information this morning. Definitely helpful. Again, 0758 123 444. Aashka's waiting for you.